One day after House Republicans passed a bill to repeal and replace Obamacare, Republicans in the Senate said they're writing their own bill from scratch. Nancy Cordes tells us the House bill would have profound impacts on Americans who get their health care through Medicaid.
I'm going to feel your neck.
Dr. Gwen Grady runs a program called PACE, providing comprehensive care for 600 elderly patients in Detroit. Like nearly 70 million Americans, they all rely on Medicaid. Without it,
a number of these people prematurely would end up in nursing homes. Or number two, these people would end up in emergency rooms getting their primary care and ultimately end up in hospitals receiving care.
The bill is passed, and without
the GOP plan that passed the House yesterday would, for the first time, place caps on federal Medicaid funding to states starting in 2020. The bill would halt federal payments for Obamacare's expansion of Medicaid to people living just above the poverty line. The 32 states that participated in that expansion would now have to either fund that coverage themselves, cut benefits, or cut enrollment. Michigan is one of those states.
And we're talking about the elderly, we're talking about children, we're talking about disabled, we're talking about mental illness. Any individual that will be eligible for the benefits that will come out of a Medicaid program will be limited in what's available for them.
All told, the GOP bill would cut an estimated $900 billion from Medicaid over the next 10 years, reducing Medicaid's ranks by 14 million people. Many Republicans, like Kentucky's Rand Paul, argue there's no choice.
We do not have enough for Medicare. We do not have enough for Social Security. We do not have enough for Medicaid. Before we got started on the expansion of Medicaid,
House Republicans say their Medicaid reforms would give states more flexibility. But many Republican governors opposed the cuts. One even called them devastating. And Scott, they are urging the Senate to now make some serious changes to that bill.
Our chief congressional correspondent, Nancy Cordes. Nancy, thank you.